I'd like to welcome our first guest on the program, and he's been here with us before. He's a regular speaker at some of our events as well. He'll be here in Atlanta at IHC Forum and Expo. Michael Levin, co-founder and CEO of Vericred. Michael, good morning.
Good morning. How are you?
How are you doing?
I'm doing well, thank you.
How was it up in New York today?
It's a beautiful day. It's finally getting a little warmer, so that's a good thing.
There you go. It's a beautiful day down here. For Atlanta, it's a little nippy, but you wouldn't like me saying that since it's going to be a high of 74 today. So,
that's not what I want to be hearing right now.
Yeah. Michael, you got an important topic here, decision support for effective health insurance shopping experience. But before we kind of dive into that, give our audience a little backgrounder on yourself and Vericred, if you would, please.
Sure. So Vericred is a data platform on which modern health insurance quoting and shopping experiences are built. And essentially we're providing 3 data sets to a host of technology companies that are transforming that whole shopping experience. Those data sets are plan design and rate data, which speaks to the different coverages and benefits and costs of particular plans. The second data set is provider network data, which, amongst other use cases, enables a shopping experience to show whether your doctors and preferred facilities are in or out of a plan. And then third is formulary data that we're just now launching that will allow or enable that same kind of experience on the drug side. So I take these drugs on a daily basis, and I want to know that when I'm buying a plan that those drugs are covered and at the lowest possible tier level. So that's what we do. We're a data company, and we're enabling what is a dramatic transformation in the whole health insurance shopping experience with new business models, new platforms, and new individual and group experiences.
Yeah, it's a pretty confusing world out there for these first-time consumers, right?
It is.
Yeah. So you talk a lot, or you talk about health plans for under 65 individuals, senior small groups are becoming homogenized. Kind of clarify that a little bit. What do you mean by this?
Sure. Well, we've seen this push both at a federal and state level. So, for example, Medicare products are all standardized, and now we're seeing in the individual market a push at the state level. California is a good example, and at the federal level through CMS's new guidance for the 2017 plans that are requiring or recommending standardized plan designs. So the core benefits, deductibles, co-pays for those key elements that people use on a day-to-day basis will be standardized across different carriers. So each carrier who's participating will offer some of these standardized plans. So as a result, when you're an individual or a group shopping for a plan, you may well see numerous plans with essentially the same core benefits. And it's further exacerbated by the fact that the market is competitive. So not only will you see the same core benefits, but you'll see great similarity in plan costs.
When you look at businesses and employees and other individuals shopping for health insurance, I mean, how do they differentiate between plans? I mean, just help me with that, and then kind of what do you guys do to help that take place?
So, not only is there a homogenization of plans going on, but there's a proliferation of plans. As an individual here in New York City where I sit, there's well over 130 plans from 6 or 7 carriers that are available. If you're a small business owner in Portland, Oregon, there's over 600 small group plans from 13 different carriers from which to choose. So the question is, how do you choose? If the pricing is very similar and the benefits have become homogenized, what are the differing factors? And the key differing factors are becoming provider networks and formularies. There's been a lot of talk about provider networks and particularly narrow networks. And indeed, networks from these different carriers and even within a carrier are markedly different. And similarly, on the formulary side, there are big differences. So the question is, when you're shopping, if the plan design is the same and the prices are the same, well, quite simply, are my doctors in or out? Are my drugs covered? And if so, at what level? I mean, this is now become the core differentiating feature between these plans because of these other dynamics that are playing out in the broader market.
Yeah, and it probably highlights one of the reasons people typically just continue doing the same thing they've always done, which isn't necessarily the right plan for them, correct? It's just so overwhelming and so confusing to them.
That's correct. And, so what's happening, and I talk about these technology platforms and the transformation, what's happening here is we've moved from, a paper broker model where half a dozen plan choices will be given or shown to an individual or a group, to technology platforms that start out with a laundry list of plans. So, for example, those 600 plans that we talked about. But that's overwhelming. So, how do you start to cull and figure out what's right? Well, the first thing that I would say is there's no single answer that is right for every constituency out there. I heard before I hopped on talking about millennials and what are they looking for. Well, they're looking for a very different user journey, right, than is a 50-year-old with a bunch of kids and maybe the start of some physical ailments. So, you hear a lot about different user journeys, and we've got the right one. Well, it's our belief that there is no single user journey that is right for everyone.
Yeah. So talk about you're kind of alluding to the features of an ideal shopping experience. It depends on the demographics of who the shopper is, correct?
It does. The good news is it's evolving, and now it's evolving really quickly. So it's exciting. So, as I said, you went from this, not a lot of transparency on plan choice to now overwhelming transparency in plan choice. So where do you go from there? Some of the first and very basic capabilities are what we call provider-centric search. So the ability to enter your doctors as part of that plan search process and quite simply see who's in and who's out. And because of the differentiation in these different networks, very quickly as an individual or even as a group, you'll see certain plans supported by certain networks float to the top. It becomes a very effective gross filter. Similarly on drugs. If you put in your drugs and see where they're covered or if they're covered, and if so, at what tier level. So these are very basic filters that we would expect in any kind of shopping experience. When, if you're shopping for a TV, you put in the size range and you put in the kind of TV you want. So we look at it and say these are really basic elements. And this has been echoed by HealthCare.gov in the last open enrollment period. They brought forth as beta features provider-centric search and drug search as their part of their shopping experience. So they kind of set a minimum bar on at least that functionality. And we see that over the next year and a half, 2 years, it's going to be ubiquitous. There won't be a shopping experience where you don't enter your doctors and drugs and see the resulting output. But then it goes further from there. If I have health issues or I'm utilizing my health insurance, I may want to see which plan design, going back to those homogenized plan designs, works well for me. And there's a number of great companies doing some really interesting work here, asking questions about utilization, about number of doctors, about health conditions, about drugs, and making planned recommendations or rankings to help people cull from those 130 plans or 600 plans to the one that's right for them financially, with their doctors, and covering the drugs that they take every day.
So there's a lot of change out there with the networks, and there's a lot of talk about the emerging narrow networks and, the big networks. And, the assumption isn't a big network fundamentally better than a narrow network? Is that true or false?
Well, we hear that all the time, and I think that that originated out of a lack of transparency tools. In the absence of tools, bigger sounds better, more doctors sounds better. And we're really passionate about this. We eat, sleep, and breathe provider networks here. And we like to take the approach that it's not the size that's important, it's the fit that counts. So, a broad national network with tens of thousands of providers, maybe hundreds of thousands of providers, doesn't benefit someone who rarely leaves their state. I mean, healthcare is local. So, what's important to that individual? It's important to know whether their doctors and their preferred facilities are in a network. And as I said a little bit earlier, that varies dramatically even within a local or regional area between these different networks. So are your doctors in? Are new doctors accessible if you needed? And by accessible, I mean in your area, accepting new patients. That's more important than sheer number. So now we're seeing with the data that we're bringing to the market, transparency tools that really answer these questions. And by the way, if you can find that narrow network plan that fits your needs, has your doctors and has new doctors accessible, as an individual and indeed as a group, you can save 15 to 35% on that same plan design, but with a narrow network. So not only does network fit give rise to greater satisfaction in the plan choice because your doctors are in and you can find new doctors, but also because you can save money.
Yeah, that makes a lot of sense. So you kind of alluded to formularies, and you're kind of talking about it now. Can you dive a little deeper on why you see them as the next neural networks?
Yeah, we've been talking quite a bit, including at some of your conferences, about this. There's a lot of talk about drug prices, the raw cost of drugs, and a $2 pill that's now a $1,000 pill. But what we're seeing here is a subtler change in formulary design between the carriers, where drugs are being shifted in tiers. And for those who aren't as familiar with network tiers, a plan typically has differing benefits or co-pays or co-insurance for different tiers of the network, with tier 1 being the lowest copay. Maybe it's a $5 on a generic drug, going up to a much more significant copay. So where a drug lands in that spectrum is incredibly important. And we're seeing changes, small incremental changes. And what's happening here are drugs that were formerly, a tier 1 or tier 2 drug that were, if you will, affordable under plan designs, are now tier 3 drugs. So the costs are going up to utilizers who take those drugs. So there's this undercurrent of shift, and the reason we refer to them as the next narrow networks is, again, it's about finding the right formulary based on the drugs that you take. And what we're hearing from users, and this is kind of interesting, is in some ways the formularies are almost more important than the provider networks, because if I'm on a drug, I may be on it for the rest of my life. So it's really important for me to have a plan that will support me and that is financially amenable to my taking that drug. My doctor may retire next year, and I'm not trying to minimize the importance of doctors, but these formularies are incredibly important, and they're changing. Just by way of example, AARP ran a piece last year on the copays for the same drugs in Part D plans. So standardized plan design, what's the copays? And the differences between different formularies are stunning. One drug, depending on which plan plan you're on, between the highest and lowest pay copay of the 19 plans in that area, is a $535 a month difference. And that's just indicative or representative of what's happening there. So why do we call the next narrow networks? Because changes are happening that are affecting the cost and accessibility of drugs, much like an analogy to what's been happening in the provider network side.
That's good. Michael, it's been great having you on this morning, and I want to remind my audience that you will be speaking at IHC Forum and Expo on May 24th and 26th here in Atlanta, for those of listeners who are going to join us there. And, leave our audience with a few takeaways, if you would, please.
So, takeaways, everyone knows that there's a transformation going on here in health insurance. We see that networks and formularies are becoming the key differentiating factors between plans. Bigger is not necessarily better when it comes to network fit, and as we just finished up talking, formularies are the next narrow networks.
Yeah. Michael, pleasure having you on again. Enjoy your weekend up in New York, and we'll see you real soon here in Atlanta.
Thanks so much for the opportunity.